And if I don't say,
It's okay, go ahead.
oh, if I don't say anything right, just let me
Okay.
know.
Hi there, and thank you for taking the time to watch this short testimonial video about our office, Parker Integrative Health. I'm sitting here today with Shannon, one of our neurofeedback patients, and we just wanted to share some of her remarkable results. Shannon, remind me, why did you first contact our office?
Well, I contacted your office from a friend out of desperation. I have suffered from chronic vertigo since 2014, and it was debilitating to the point where I was walking along walls. I would have to crawl if it was at night because the shadows would make my vertigo, where I would be disoriented. And I had one of my attacks while I was driving, and I had my young son in the car,
Remember.
and it really scared me. And at that point, I was actually on medication um, for ocular and vestibular migraines with the vertigo, but I still had that breakthrough, and I had to find something that was I knew that there was something else out there.
If I remember, and if I might interject, if I recall, you weren't feeling safe in your own body, and you were looking for some way to feel safe on a day-to-day basis.
Yes, that would be true. Minute by minute,
Right.
yes.
How long have you been suffering with this particular condition? I think you touched on it, but let's highlight that. Like the
Yeah.
vestibular migraines, that vertigo. It's been a number of years.
Yeah, so since 2014, I had started a new job, and within a month, all of a sudden, I started having these vertigo attacks, and it came out of nowhere. I tried the diet thing, taking out the caffeine, taking out the chocolate, eating a vegan diet. I tried all those things, and nothing really seemed to work. Nothing seemed to really touch it. I had to be on a wait list to get into an ENT to try to work on my crystals, um, and learn the Epley's maneuver, the log maneuver. I was doing them 5, 6, 7 times a day just to try to get like moments of relief.
Right. And those maneuvers that you're referring to are specifically for the vertigo portion, not for the migraines, correct?
Correct. Yes.
So
Yes.
it doesn't relieve the pain, it is
No.
intended to relieve the instability.
Correct. Yes.
And then you've talked a little bit about what you've tried before reaching out to Parker Integrative Health, in addition to trying to get in with the ear, nose, and throat, the
Yes.
ENT, and doing some of these vertigo maneuvers. What else had you tried? I know you were on medication as well.
Yes, so they had done all of they did an ENG where they blow the air and then they
Mm-hmm.
blow the water and they bring up the temperatures hot and they bring up the temperatures cold to check your balance, to
Right.
check all your things. You wear the headpieces where they watch your eyes when they do certain maneuvers to you, and they put you in a chair, forcing you into some vertigo attacks. And I did it all. I did blood tests. I did MRI. I did just
So testing
everything.
after testing after
Yes.
testing,
Yep.
and to no real result, if I recall.
No. Yeah. Yeah.
Um, how do you feel now? You are about 40 sessions in
Correct.
to
Yes.
neurofeedback,
Yes. Yeah.
and how are you feeling today?
Uh, I can't. I can't even say how blessed I feel that I found you guys. Um,
I knew when we talked. I
I,
remember this.
I mean, I truly feel blessed. I feel like God interceded and helped me find you because I was at my wit's end. I felt like I couldn't protect my son. I couldn't protect myself. I didn't know how I was going to work. And drugs were not the answer. Like it was just, and then I was having the side effects from the drugs, and it, everything was just so bad. And I came in here and I was a skeptic. I kind of thought, well, I'm desperate. I want to try anything. Um, and I came for that initial brain mapping, and I kind of I felt like cautiously optimistic. And then when I talked with Dr. Powell and she did more tests and everything, I was like, wow, I really feel hopeful. So I was kind of shifting to the hopeful, and I was like, you know what, I'm going to try this. I want to try this. And I think within 2 or 3 sessions, I actually felt like a little bit of myself had come back, and felt a little bit lighter, and I felt like I could protect my son. I felt like I could go to work.
Like there was some forward motion, at least in
Yes.
that direction.
Yes, and I
How
wasn't
long
in
did
this
it
hole.
take before you were really starting to feel results on a regular basis, like physical differences on a regular basis?
Well, the first couple times I went to the neurofeedback, I was exhausted.
Right.
Just pure exhaustion. But it was a happy exhaustion.
Right.
And then I think within 6 visits, I felt ready to like maybe take down my medication a little bit. And
Now that's very fast. So I mean,
yeah,
this
it
is
was very, very fast, and I wasn't successful.
right.
And
You had to go back up.
I did, and I think I was just so excited I got caught up in it. So then I contacted back with the doctor, and we worked on it later. But I can't say I felt happier. I felt happier when I woke up. I felt happier through the day. I found myself where I wasn't walking along the walls. And then the first time that I walked out in the evening and I didn't have a death grip on my son to try to keep my balance, my son turned to me. It was Halloween, and I remember, and he was just like, "Mom, you're walking." Like, and just the realization of that was just life changing. It truly was life changing.
And when were you able to start reducing that medication? Because that was a goal of yours when you came
Yes,
in.
yes, because of all the side effects. I think I was like 10 into it, 10 neurofeedbacks into it, and started to go down really, really slowly, really slowly. Slower
And
than
of
what I
course,
would
you
like,
were
but
working with your
slower than
primary
yes,
to
yes,
reduce that.
absolutely.
That isn't something that we just
No.
did.
No. And
but
it's not, and you can't go off those drugs because they're just so hard on the system, and you need the drug. Unfortunately, once you get to a certain point, you need the drugs to get to the other side. So you have to just take those little baby steps down. But every baby step is a celebration, and that your brain feels better.
And you're starting to meet
better.
that goal that was so important to you.
Yes.
Would you recommend our office to friends and family?
I already have.
I know you have. I know you have.
I talk about it all the time. Whenever anybody ever says anything, even remotely so, I even contacted the ENT doctors and things that I work with. I'm like, they're amazing. And, and I really truly feel that if you can't help me, you're going to be honest with me and say, I can't help you, but steer me in the right direction. And that's amazing.
Yes.
You don't find many people like that.
And for you, we have, each individual receives like a very individualized treatment protocol. Yours was neurofeedback with some chiropractic.
Yes.
And that's vestibular migraines. Some can be treated by neurofeedback, some cannot. We were very hopeful, and that's why we did the brain map, because you tried everything else.
Yeah.
Overall, how would you rate the care that you received in our office?
I cannot name one time when I've called the office where I have not been greeted kindly, where all my questions haven't been answered, where I haven't felt taken care of. I've never felt rushed. I tend to be a person that has a lot of questions, and you always take the time, or whoever's at the office, or always take the time, always answer my questions. I always feel like I got everything on my list accomplished. And a lot of times when you go to the doctor's office, okay, you got 5 minutes, that's it. And you never feel like that here. Even on the phone, you don't feel like that, which is amazing.
Well, I'm glad we tried. First, I want to thank you for taking the time to share. It was a big experience. You had a big goal. We had a big result. And it's not every day that we have these success stories. But before we say goodbye, is there anything that you feel that we haven't talked about in your experience here that you want to add?
Anyone who watches this and sees if they're in that hole of just desperation, it takes a leap of faith to walk through the door and to try that. And I can't say how important it is to try. Just try. And
I think you and I talked about, like, that walking through our door, often people feel like this is the last option. There's nothing else to try. It's the end of the road. There's nothing there. I don't know what else to do. And having been employed with the doctors for 3 years and having been a patient before that, I feel like walking through the door is actually the beginning of a road, not the end. And I don't know. I'm getting sidetracked, and that's going to get edited out. But I'm going to let you. I know you have an appointment, and I want to keep you on time. So I think we're going to say goodbye, and I thank you.